I didn't even want to live anymore. Monogram is the one that saved my life. I used to be a clown at Ringer Brothers Circus. Magic is the most joyful thing it gives me because I make so many people forget their problems, and it gives them a little time to clear their soul. Monogram makes you feel like you're somebody. That's what it's all about, because they give people hope.
Dennis has diabetes. His diabetes affects his kidneys, so he, has chronic kidney disease. Dennis also has heart failure. He really needs the extra support right now.
I've been in the hospital so many times, it was just hell. I mean, I know my family members would help me, but I don't want to be a burden to them.
Dennis doesn't read educational materials written out, but he is great with numbers.
I went to these doctors, and they write these pieces of paper down. I tell them I can't read, and I just don't understand. You go there, and it's just, it blows your mind. If they put like 1, 2, 3, 4, 5, I can understand. And Alexa, she made me a scale, and I put it onto my little cabinet there.
I did some teach back with him. I said, Dennis, if your blood sugar was 250, how many units would you give yourself? And we just went over it, and he was able to look at the sliding scale and say, I would give myself this many units. And then I said, again, okay, if your blood sugar was 400, how many units would you give yourself? And he's able to teach back.
It's a blessed place. I mean, I couldn't ask for any better service.
The personalization of that care made him able to better understand how to give his insulin, which will help better control his diabetes, which will help lower his A1C, which will help many other health issues as well. Most of our patients at Monogram have polychronic conditions. We're able to work as a team. We have our pod medical director, we have our APPs, our nurses, our social work. We're able to all work together so that we can focus on all of the issues that a person has rather than, just going in and focusing on one thing. For him in particular starts with the social work aspect, because once he gets all of the situation under control with housing and all the support that he needs, he's going to be more able to follow the direction of the medical team, and he'll better be able to focus on his health.
When I first met Dennis had many issues. He had some financial issues, some housing, some food, transportation. I was able to help him apply for programs so that he was able to get the assistance that he needed. He was able to get transportation to appointments. He was able to get food so that he didn't have to worry about where his next meal was coming from. We applied for SNAP, which is food stamp benefits. He got approved for that, so he's able to get extra money to go food shopping. I gave him a listing of food pantries, so he's able to go get meals. Also helped him apply for Medicaid. He was recently approved for that, so we're trying to help him get housing through Medicaid. We applied for utility assistance. He recently just got approved for that, so that's a big help because that's an extra $300 for him. We also are trying to get him a cell phone right now through the Safe Link, so we're going to actually do that next. He got approved, so I'm going to help him get a phone. We did PAD, which is prescription assistance, so now his prescriptions are less money and he gets more money in his pocket. He also got a refund because he doesn't have to pay the premium anymore. Just many things that I've helped him with, and I know he's very grateful for it.
Well, having my social things met, it's been the best for me. At least now I know I can eat. At least now I know I have some bills that will be paid. When you can live in your own house and stay here instead of going to the hospital and staying a week, 2 weeks, it's just amazing.
We provide this service to all of our patients, no matter where they live in the community, and we go and meet them where they're at. We take time to come into their home so that we can help them with whatever they need. Being able to help him with those social determinants helps him be able to focus on his health.
They're the ones that make me live. These are the ones who give me hope and make me get up in the morning and make me feel great. And I feel like Alexa said, I'm somebody. And let me tell you, they are the greatest.